Start.
Hello,
Hello.
this is Dr. Gabra, the doctor in the medical admission unit. Are you Mrs. Mila Kones, 34-year-old?
Yes, Doctor. I am.
Nice to meet you, Miss Mila. How can I address you?
Nice to meet you, Doctor. Please call me Mila.
Okay, Miss Mila, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, Doctor.
During the conversation, maybe I will write some notes. It will be totally confidential. Is that okay with you?
Okay, Doctor.
So, Miss Mila, I understand from the letter that you have some tiredness. Can you tell me in your word more about it?
Doctor, for last couple of years, I noticed that I am becoming easily fatigued, easily tired. I thought that it was due to my some depression, that I had some problem in my family, so that I thought that it would be like from that. But the condition is getting worse day by day. And about a year ago, I visited my GP. I told him everything, that I am having this weakness and tiredness all the time. He then ran some blood test. He said that my blood level is somewhat lower than the normal. Then he gave me some iron tablets, and after that, he also said that there are some problem in my thyroid gland. He gave me some medication for taking for thyroxine. I am taking that for quite long time. That improved my condition a very little, but my symptoms aren't going away totally. I still face the same problem. So I am really worried, doctor, if it is a cancer or not. I heard that cancer patients feel like this.
I'm sorry, Miss Mila, about you are suffering. I'll try my best to help you. Miss Mila, you said this symptom from few weeks ago. Did you have any similar symptom before?
A few years ago, doctor. No, I haven't this before.
Okay, and does it started suddenly or gradually?
Gradually.
And how it progressed during time?
It is increasing, doctor, I think.
Do you notice anything make it improve a little?
No, doctor. I feel weakness and tiredness all the time. Just I need to take a rest a lot. That makes me somewhat feel better.
Do you notice anything make it worse?
I feel weak all the time, and there is nothing significant that can make it worse.
I'm sorry about that. Mrs. Mila, do you have any change in your color to be pale or yellowish discoloration?
Uh, all my relatives said that I am becoming paler day by day.
And do you have any skin changes otherwise, like darkening of your skin?
No, doctor.
Any change in your skin color or mucous color in your oral orifices?
No,
In your hand?
no. I think they are becoming paler.
Yes. And do you have, how's your appetite?
I think it is not much changed.
And how's your weight? Any weight changes?
Not significantly, but I am not gaining much weight.
And do you notice any lump or bump in your body?
No,
And do you have any swelling in front of your neck?
no,
And can you tell me if you have any raise in body temperature?
no,
Any sweating?
no.
Do you have any weather preferences to cold or hot?
Previously, before starting the medication, thyroxine, I preferred hot weather. but now I don't have any problem with that.
Do you have any shaking of your hand?
No,
And do you have any problem while combing your hand, your
no,
hair?
no.
And do you have any difficulty standing from sitting position?
Yes, doctor. I feel somewhat dizzy on when I try to stand up.
And and do you have any difficulty climbing the stair?
No,
Okay, you said you feel dizzy when you stand from sitting position. Have you ever lost your conscious?
no.
Have you ever checked your blood sugar at this point?
I checked not during the symptoms, but I checked at a GP's clinic, and it was normal.
And do you have, when you have this dizziness, hunger feeling,
No,
any sweating?
no,
Okay. Do you have any tummy ache?
no,
Any feeling sick or throwing up?
no.
Uh, Mrs. Mila, can I ask you if you have any history or medical history of note, like high blood pressure or high blood sugar?
No,
Any history of exposure to tuberculosis, something called tuberculosis?
no,
Okay. And do you have any previous medical history of no?
no. I was completely normal, but one thing that I needed admission to give birth my last child, and I was admitted at that time. I had problem during that time.
Sorry, but I didn't get you. What is the problem?
There was a doctor. There was my liver pain was lasting for a long time. It lasted for more than 2 days. I needed hospital admission at that time. I tried to deliver by normal delivery, but
Mm.
it didn't happen. I needed seizure at that time, and I was sick at that time.
And you lost a lot of blood,
Yes, doctor. The seizure was
and
not so good. It was
you need blood transfusion at that point.
yes, doctor.
I'm sorry about that. And when was that?
3 years ago.
3 years ago. Okay, Mrs. Mila. And otherwise, do you have any other operation or other admission?
No,
Any family history of no?
my mother had diabetes.
Okay. Mrs. Mila, can I ask you if you have any headache,
No,
any vision problem, like
I feel
problem?
somewhat blackening of my vision when I try to stand up from the sitting position rapidly.
Hmm, I'm sorry about that. Uh, do you have any weakness in any part of your body?
Not any specific part, but general, all over my body.
Sorry?
It's all over my body, not any specific part.
Uh, and any history of fits?
No,
Have you ever lost your conscious?
no.
Okay, Mrs. Mila. Do you have any problem like racing or pacing of your heart?
Sometimes I feel that.
Is it frequent? How often?
Not so frequent, doctor.
What do you feel? Do you feel your heart running so fast or so slow?
Running so fast.
And can you tap it for me? Is it regular, irregular?
It's regular and fast.
Okay. And since when this one?
Maybe for last 2 or 3 years.
Okay. And have you ever seek a doctor advice for this?
No,
Do you have any shortness of breath?
no,
Any noisy chest?
no,
Any chest tightening?
no,
Any problem in your water work?
no.
Can I ask you a sensitive question, please? I want to ask you about your period. Is it regular, irregular, and when the last period is?
No, doctor. I have not passed any blood for last 3 years. Passed only a little blood, very little, and no menstruation for the last 3 years. Almost no menstruation.
And any pregnancy? When the last pregnancy? This 3 years ago? Last
3 years ago, yes, doctor.
delivery? And do you take any pills?
No,
Okay. And can I ask you a sensitive question, please? How is your ultimate
sorry, I
relationship?
didn't get you.
Ultimate relationship with your husband?
Doctor, I think that I am feeling less arts than before.
I'm sorry about that. I tried my best to help you in this regard.
Yes, doctor, it is causing a family problem for me. I told you that I thought it was due to depression.
I'm sorry about that. Try my best to help you in this
10 minutes have
regard.
passed.
So Mrs. Miller, can I examine you, Mrs.
Okay.
Okay, I will take general look. Patient look underweight, normal, overweight,
This is a sarrow weight, but you can examine this normal weight.
normal. Is there obvious pallor?
No,
Any yellowish discourage, jaundice, anything?
no.
Okay, I'll check vital sign, heart rate, and blood pressure, and sitting and standing position.
Okay, heart rate is 82 beats per minute, and blood pressure on sitting is 110/70, and on standing it is 90/60.
Okay, and I will look to the eye, any pillar, any jaundice, to
No,
the mouth, if there is any pigmentation in the mouth.
no,
I I will do heart cardiovascular examination, check the heart, the, any any adding sound, any basal crepitation, any
no,
murmur.
no,
I'll check the abdomen, any tenderness,
no,
any organomegaly.
no,
I'll check the leg for any edema.
no,
I'll check for proximal myopathy.
no.
Okay, Mrs. Mila, what is your concern for me?
Why I am having this, doctor? Is it a cancer?
Mrs. Mila, after I talk to you and examine you, it doesn't seem that you have a cancer, but you have a condition called sheehan syndrome. It is a condition in which caused by the deficiency in secretion of the one of your glands sitting in your brain. This cause most likely after your delivery, complicated delivery 3 years ago. There is reduce in the blood perfusion to your this gland and causing reducing in hair secretion and causing all your symptoms by decreasing affecting your blood pressure and your tiredness, and affecting your even your blood sugar and your ultimate relationship. For that, we will refer you to group of specialists, including the gland doctor and my consultant, and the and we'll run for you some tests to confirm the diagnosis, and maybe you need imaging also. After that, you need to replace you with the hormone that replace the deficiency in your secretion. Is that clear for you?
Okay, doctor.
Any more concern for me, Mrs.
Will I be completely okay, doctor? Will I get a normal life?
Sorry?
Will I get a normal life?
I'm sorry to tell you, Mrs. Milla, your disease cannot be curable, but we can control the symptom. So you can live near normal life. Many person like you have this symptom and live near normal life by replacing the hormone, and you will be under follow up and treatment.
Okay,
And
doctor.
you
Thank
will
you.
need, and will provide you with a bracelet that to your doctor and everybody will know that you need such treatment when you have any problem, and when you review your doctor, inform him about your condition.
Okay, doctor. Thank you.
Thank you.
You have still 1 minute.
That's all.
You want to finish?
Finish. Yeah.
Okay. In the history taking, you are fine. I have nothing to say more about that. You should have asked that how much this condition is affecting her daily life or personal life. Okay. And also, you haven't asked any personal history, any smoking, any alcohol consumption, any about her job, about her family support, driving. Okay.
Hmm.
And also, you haven't checked for any visual field or any visual problem. You should have checked for that. And also, you should have told that you want to examine her you want to do the fundoscopy and urine routine examination. Okay.
Mm-mm.
This can also be a case of pituitary tumor.
Yes.
And also, you have suspected that this is a case of Sheehan syndrome. So you should have asked about her health of last child, her
What is it?
breastfeeding.
Breastfeeding. Yeah.
Okay. That can be the earliest sign that of Sheehan syndrome, that inability to produce milk. Okay. And also, this can be a case of primary gonadal failure. So you should have asked about any history, family history of not menstruation at early age. Sorry, by stoppage of menstruation at early age. Any stress, any recent weight change, sudden weight change, that can also cause the sudden onset of the menstruation. Also, any injury to the head, that can be a case. Any infection in the past. Okay, you should have excluded that it's Sheehan syndrome. It is a Sheehan syndrome that is due to pituitary hemorrhage or pituitary blood insufficiency, circulatory failure. Okay. Any headache before the onset of this? You need to rule out any pituitary apoplexy. Okay. So have you reached your diagnosis?
I reach, but I don't feel happy about my performance.
Okay. Have you reached your diagnosis?
Yes,
Okay. What is your diagnosis?
it is pituitary deficiency secondary to Sheehan syndrome, secondary to complicated delivery 3 years ago, causing all symptom of pituitary deficiency, uh, adrenal deficiency, and sexual deficiency, and thyroid deficiency.
Okay. So how do you like to investigate?
This patient need MRI of the brain, need cortisol level and TSH 3T3, 3T4, and sexual hormone level. And we will do SATH test to see the response of the adrenal gland to confirm the diagnosis of adrenal deficiency.
Any other test?
We need basic investigation like complete blood count, RFT, LFT, electrolyte will show hyperkalemia and hyponatremia, and glucose level.
Okay. Do you think serum prolactin level should be done?
Which one?
Prolactin level.
Prolactin, yes.
Okay. And do you think MRI of the pituitary gland?
Yes, I mentioned it.
Oh,
MRI of the brain.
okay. Fine. So how will you manage that?
Management patient need admission, IV fluid, hydrocortisone, and if needed, and will provide with and replacement of all hormone, and will provide with the bracelet for future plan, educate patient, counseling education of the patient about the disease.
Okay. So why do you think that patient need admission?
Because all symptoms she need IV fluid and to stabilize the condition. She doesn't look well. She has hypotension, so she need resuscitation by IV fluid and IV steroid.
Yeah, I think actually this is stable for a long time, so she doesn't need any aggressive treatment at this stage. Okay, and do you think involvement of the multidisciplinary team would be necessary?
Sure.
Okay, so whom do you want to involve?
My consultant, gland specialist,
What do you mean
and
by gland
nutrition,
specialist?
endocrinologist,
Okay, then.
and nutritionist,
Okay, then.
radiologist,
Then,
woman doctor,
what do you mean by women doctor?
gynae or gynae.
Any other? Do you think involvement of the psychiatrist will be necessary that this patient has depression and also have problem with sexual health?
Yes.
Do you think involvement of the social care department?
Yes,
Okay, thank you.
thank you.
Actually, you did well. Just you missed something about personal history. Otherwise, you have done well.
But not in confident and flow way.
You will do it. You will definitely do well in the exam.